That's required. Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We're so happy that you chose to spend some time with us. There are a lot of things that we need to talk about, and we are going to jump right in. I will turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone. Thank you, Dr. Neighbor. Thank you, Dr. Hines and Dr. Walk and Simon. There must be a guy named Murphy who was present and active all night long. We had problems with our invitations, but Simon solved the problem and got them out early this morning. So thank you for persisting with us and being. So we should have an interesting discussion. I sent each of our moderators a set of slides that we'll co-read, and some of them are made specifically for our behaviorists that are on the line, as well as for our audience. So Simon, let's go with our first slide, if you would. So we've often talked about nutrition, and our first talk is about nutrition, some things that have been found. And you should be very aware of these issues. Go to the first slide, Simon. About one of my favorite foods.
I have a solution for you.
What's that?
An air fryer.
Okay. So French fries, they're greasy, starchy, and they're comfort food for many. But researchers in fried foods say that they have a negative impact on mental health. That's for you, Dr. Walks. A research team in Hangzhou, China, found that frequent consumption of fried foods, especially fried potatoes, result in a 12% higher risk in anxiety and a 7% higher risk of depression in people who didn't eat fried foods. Let's go to the next slide. So, Ivan, can you read this one?
Yes. French fries, slide number 2. The link was more pronounced among young men and younger consumers. Fried foods are known risk factors for obesity, high blood pressure, and other health effects. These results open an avenue in the significance of reducing fried food consumption for mental health. Experts who study nutrition said the results are preliminary, and it's not necessarily clear whether the fried foods were driving mental health issues or people experiencing symptoms of depression or anxiety turned to fried foods.
So the next slide, I especially wanted you to see this, Dr. Walks. Next slide.
Go ahead, Simon. Hit me with it. Zebrafish acrylamide. We're not going to discuss the French fries, Dr. Maxey?
Go ahead, finish this one.
Okay. In a new study, researchers suggest that acrylamide, a chemical formed during the frying process, especially in fried potatoes, is to blame for the higher risk of anxiety and depression. In a separate paper referenced in this new study, the researchers exposed zebrafish to the chemical, finding that long-term exposure had caused the fish to dwell in dark zones within the tank, a common sign of higher anxiety in the fish. The zebrafish also displayed a reduced ability to explore their tanks and socialize, as they did not swim closely with other zebrafish, even though zebrafish are known to form schools with their species. Zebrafish were presumably chosen because they were already known to be vulnerable to acrylamide toxicity, and because their behavioral responses to anxiety are established and consistent, offering a source of both biological and behavioral data.
I think there's one more slide on this.
No, that's enough.
So in relation to what Dr. Neighbor also said, I don't know that the air fryer makes it any better. I don't think it's the grease, but it could be the cooking process in general, because it also happens in toast, and especially when you heat meat and other things. So let's discuss how this can affect your anxiety and mental health. Any insights on that, Dr. Walks and other moderators?
Dr. Maxey, I think it's interesting that the initial research is before we got to the zebrafish. Dr. Maxey, I don't even know what a zebrafish is, and I'm a little concerned about copying the behavior of something I don't know. But having said that, I think yes, it's well established that fried foods, including fried chicken, fried everything else, is not the best way to go about meeting your daily consumption requirements. Yes, completely agree with that. Whether people eat more fried foods when they're anxious and or depressed because it's comfort food, or whether fried foods cause you to be anxious and depressed, it sounds like from the research we have so far that the jury is still out on that as far as people are concerned. We can just state that everything in moderation. I love Del Taco French fries, Dr. Maxey, but there are no Del Tacos on the East Coast. So when I come to California, I can get all the Del Taco fries I want because it's maybe once every month or two. So there you go.
Dr. Neighbor Stephen, you're the cook in the group. What are your comments? You were talking about air frying?
Yeah, well, I thought they were going to air fry the zebrafish, but
they're kind of little.
Y'all gotta watch more cartoons. So finally, there's a lovely zebrafish in the Finding Nemo. You need to get with the kids know what the zebrafish are.
So
go ahead, Dr. Neighbor Stephen.
Explain, and this, we're not going to take it too deep, but what they didn't explain was, or maybe you all know and I just am not aware, where the is located. Is it in the grease or is it in the object that's being fried?
Well, when I read the article, it suggested that because it occurs in toast, which has no grease associated with it, and other things that you simply heat, it's in the actual heating process that it may be when you, they find acrylamide even in toast and in things that are not being fried in grease. So I think
if that's the case, then that begs the question, are you supposed to eat everything raw? I mean, if heat is going to convert the acrylamide, the only way you can avoid the acrylamide is not to cook the food.
No, it's somehow in the charring of it. Dr. Hines, you're younger than all of us. You don't know anything about the chemistry of this?
I'll char my toast.
No, I this was news to me, but I will say what I thought about when I read it is around, for all my vegans and vegetarians, a lot of the and I think I've shared with you all that my son is a vegetarian. A lot of the meat substitutes and things like that, they come in that they're, you've got fried cauliflower that's supposed to, replace your chicken wings. There, you can get, fried not chicken nuggets to replace chicken nuggets. French fries are a staple, like a fast food item for folks that don't eat meat. They're readily available, those kinds of things. So I think one of the take-home messages, even if we haven't gotten to the root of, where this particular chemical is, for those who are trying to be healthier by not eating meat, you still have to make smart food choices, even when you're not eating meat. And again, like I said, I get it, because a lot of those options, that's how it's being marketed to more that's how non-meat things or vegan and vegetarian things are being marketed in a more mainstream way. It's by fried tofu, fried all kinds of stuff, which can lead you to a place that you didn't intend to be while you were trying to be healthy.
Okay. The other thing that we note is that there are certain oils that are used in frying that are particularly bad and some that are better. Like avocado oil, I understand, is better than olive oil, which has a low burning point. Any comments on that?
So Dr. Maxey, there's a comment in the chat that according to Google, if we can trust Google, that the air frying reduces the acrylamide by up to 90%. So I think Dr. Neighbor Stevens' earliest suggestion is a good one. I would just add to that we've talked, as you started us today, Dr. Maxey, we've talked about health practices, one of them being healthy eating, combining that with all the other important things, sleep, all the other important things, exercise, and all the other important things, right? So all of these are things we have to be careful about. Let me say this about the fried food, the fried potatoes, the toast. I think all of it, we have to be careful about what we're putting in the combination of things. And, nothing beats some nice fresh vegetables, right? So shouldn't be frying your cauliflower and frying your Brussels sprouts and frying your broccoli anyway.
Very good. I had a meal at Simon's house a few months ago when I was returning from Region 1. That's about a year ago now. And I had an almost all raw meal. And it was so good. Simon's mother fixed it for me. She happens to be my sister. And I think Simon helped her with some of the food, but it was really good. But let's move on to the next slide after this one.
So Dr. Maxey, you told us before that they grow very large children at Simon's house. So whatever they're feeding them, it's working.
Simon, that's on you.
There's no specific method to what it is. It's trying to make sure there's enough left for me after the fact is the real struggle.
Okay, very good.
It's called hiding.
I've tried that.
Good. So, Dr. Neighbor and Dr. Hines, this is up your alley. If you would lead us on this slide, maybe Dr. Neighbor Stevens.
So we're talking about boosters again. Actually, I'm kind of excited about talking about boosters, and I'll tell you why. I will share that a month ago, I came down with COVID, even though I am fully boosted. So naturally, my thoughts have been, I hope they come up with another one soon that will protect me going forward. So around the same time, the FDA announced that they were authorizing additional doses of Pfizer-BioNTech's bivalent COVID-19 vaccine for young immunocompromised children. They also said that kids ages 6 months to 4 years with certain types of immunocompromising conditions, like solid organ transplants, or those who are considered to have a similar level of immunocompromise, and who previously received 3 doses of the primary 0.2 ml of the company's monovalent or bivalent vaccine, a fourth dose using the bivalent can now be administered at least 1 month following the most recent dose.
Go to
Next
the next
slide,
slide.
huh? Extra doses beyond that may be administered at the discretion of the healthcare provider, taking into consideration the individual's clinical circumstances. It is updated emergency use authorization. In its updated emergency use authorization, the FDA said that a fourth bivalent dose in this patient population, as well as additional doses, may be effective in preventing serious or life-threatening disease or conditions that can be caused by SARS-CoV-2, including Omicron variant sublineages BA.4/BA.5 and other Omicron subvariants such as XBB.1.5. Remember that last number, that last variant. The agency added that the known and potential benefits outweigh the known and potential risk, addressing the group who still have concerns about vaccine.
And there's one more slide.
Next slide.
Yeah.
Recent changes in federal vaccine policy have transitioned completely to the bivalent products, which target the original strain plus Omicron BA.4/BA.5 strains, while also allowing for extra doses in high-risk groups, including adults ages 65 and over, and people with immunocompromising conditions. Adults and kids 5 years and older with immunocompromising conditions can receive an additional dose starting at 2 months from their last dose, with extra doses beyond that at the discretion of their healthcare provider.
I think that's all in this series.
Not included on this is they are still recommending, if you have had COVID, to wait at least 3 months before you get another booster. I think that we are still learning how to live with COVID, and we not only have that 1.5 variant, but we also have additional variants that are being watched to determine their impact on the community prevalence rates going forward. So this is something that, just because we don't talk about it all the time and it's not on every news story, it hasn't gone anywhere. And we need to continue to maintain our vigilance. The other point I'd like to make is all of us who were on the show when the president of Meharry talked should have not been surprised by this change in the policy, because he primed us in his talk to understand sort of the natural course things should go. With that, I'll stop.
The other thing that I took out of this, not only are they considering kids in this, but at the other end of the bell-shaped curve, it's adults 65 and older. They're considered that adults 65 and older have their own form of immunocompromise. So there's a warning here that you older people need to consider continuing to get boosters at least several times a year. That's my takeaway on this. Dr. Hines, what do you think?
I would like to just piggyback off what Dr. Neighbor-Stevens was saying about, COVID hasn't gone anywhere, especially in what is, for many of us, probably the worst allergy season that we've had in years, right? The current COVID, one of the current COVID variants that's going around has a lot of mimics to your allergies, in that it's causing, red eyes and itchy eyes, in addition to the fevers, the sore throats with some, you might be thinking it's just your postnasal drip or just your allergies. And that spin on things, it should make it, like I said, coupled with prominent allergy seasons, makes you think, wait, we should be checking for COVID Even if we think it's just our allergies, maybe it is, but maybe it isn't. And that's kind of like we were talking about, learning how to live with where we are now.
Excellent. Okay, let's go to our next series.
As we're transitioning, Dr. Maxey, part of what I just heard and what Dr. Hines said is that, well, why is it important to know that it's COVID instead of your allergies? Because if it's COVID, there's treatment. We still can get folks to reach out to their providers and get Paxlovid to help them to get through the COVID, whereas if with your allergies, you're reaching for Zyrtec or something else. So it is important for us to remember that COVID is around. It can mimic allergy symptoms, but the treatment, the course of it can be different.
Well, thank you. Dr. Hines. You know, I'm waiting for you to come back out here in California, Dr. Hines. I enjoyed meeting with a young, vibrant family practitioner.
I got you. I'm coming your way. Don't you worry.
Okay.
All right. So I'm just going to complications of COVID. While right now it's not fully known whether COVID-19 causes neurodevelopmental problems, it's long been known that an infection during pregnancy puts children at higher risk for conditions like autism, attention deficit, hyperactivity disorder, otherwise known as ADHD, and schizophrenia years later. Some research is showing boys in particular are more vulnerable.
That's not fair.
Well, and the other thing too, boys in particular were already had a higher prevalence of those same conditions too. So
yeah.
Let's go to the next slide.
There is growing evidence linking prenatal maternal infection and inflammation and risk for later neurodevelopmental disorders like ADHD, schizophrenia, said a maternal infant health expert. The expert noted that both analysis only studied babies prior to when many milestones in expression, cognitive function, and others typically emerge.
I think there's one more.
And there's
No, that's all for that one. So the suggestion is that pregnant women need to be very careful about being vaccinated so they don't have intrauterine problems with later problem with their children. That's neighbor, that's your area too, right? Have you seen any of that or heard of it?
I think that this
You can go back one slide.
interesting observations,
Go back slide.
and I eagerly await further analysis and data points, because there, as Dr. Hines pointed out, some of this association was already present without the addition of COVID, and one wants to always be careful with association studies. But having said that, you know, I know this isn't a scientific statement, but again, I think common sense would lead us to want to make sure that the pregnant woman is as protected as she can be to prevent any risk for her unborn child, either, you know, during the intrauterine period or later after birth. And we have Dr. Bean is on the line. I'd be curious to see how this hits her.
Can Dr. Bean be unmuted?
Yeah, it's again, the studies looking at the impact of acute infection in newborns and neonates were very positive, that they had, there was very little mortality. And so that does initially gave you sort of a false feeling that maybe this wasn't that bad. But as was pointed out, the problem with long-term developmental issues is they don't show up in the newborn period. So at this point, there have only been a couple of studies. And unfortunately, as been pointed out, there is a prejudice in the literature to publish only studies that show positive findings. So at this point, we know that CMV, for example, is a classic intrauterine infection in which, even though the majority of children who have it in utero don't show any clinical signs when they're born, but later on do develop developmental and other problems. At this point, we really don't have enough data to make a specific decision. However, the recommendation is immunize pregnant women, because we know that viruses which the fetus gets infected with in utero from all of us remember intrauterine infections from way back in medical school that have been shown to have major potential poor outcomes. But we don't have enough data. You all know, for example, you're talking about ADHD and behavioral problems. Remember, the majority of those children are not diagnosed until they're in that 3 to 5 year range. We have very, very few studies at this point, except the couple that have been published so far that have looked at any large number of children who were exposed in utero. So frankly, I think it's still at this point, we just don't know. And we're back to saying immunize pregnant women. We know the vaccine is safe during pregnancy, so immunize, the pregnant women should be immunized.
And Dr. Maxey, could I just take a moment and bring in another burning issue, in my opinion? Again,
sure. Of course.
You'd be curious what Dr. Bing thinks. We're having a tremendous rise in congenital syphilis cases in this country. And there are a number of contributing factors. And one of them apparently lately has been some issues with penicillin supply. But we should not, at this point in our technical development, be still struggling with congenital syphilis. So I just wanted to bring that up and to the attention of our audience that some of our bad actors from the past are making a resurgence. Polio is another one that's trying to make a resurgence. Dr. Bean, do you have any comment on that?
My comments on all of those are related to this increase in the number of people. It should be extremely, if you are, I can't, am I unmuted?
Yeah.
Yes, ma'am.
Okay, because my thing said I wasn't. The part of our problem at this point, you're absolutely correct. Syphilis has always been endemic in certain areas. So if I were in Los Angeles, we had a much higher, we always had a high incidence of syphilis. And one of the big problems was our increase in the number of patients with no prenatal care. So if you were at a place like King, we had no prenatal care incident in the range of about 30%. So we saw a lot of syphilis. The national level was about 15%, and it does tend to be in those areas where such as we had a lot of diverse population, and it's also always been in lower income population. So if you in Tennessee, the incidence of where I am now, incidence of syphilis, congenital syphilis, and syphilis itself is very low. CDC follows this. And so consequently, the sudden increase in syphilis which is now made a nationwide impact. And you now get warnings out from the CDC about the sudden increase. Isn't have anything to do with penicillin. The penicillin story is a different story, which is an interesting story, which nobody talks about. And that's the shortage of drugs. So we're at the stage now, for example, for those of you who still take care of pediatric patients, where giving bicillin was the recommendation for trying for strep throat to prevent rheumatic fever, whereas a few a few years ago, the CDC proceeded to inform us that there was a shortage of bicillin. So consequently, we shouldn't be using it anymore for treating rheumatic fever. We had to use PL medication. Not as effective, but it works. But nobody seemed to get upset about the fact that we had a shortage of penicillin. So we shortage of penicillin. But we all know the other shortages that we have had, but nobody seems to be saying much about why the pharmaceuticals companies focus upon drugs, and some of them rightly so. A lot of this occurred as a result of COVID, which they can make more money off of, or which they could justify diverting resources to making those. So old drugs. There's a shortage of furosemide. I mean, there's a shortage of dopamine. There's a shortage of Dilantin.
I think these shortages are related to the patents running out, like you said, and it's financial.
I think it's all financial as well. But there's no up in arm, there's no congressional hearing, all of that about why we should have a shortage of very specific medication. But what you all ought to be really scared about, and which really I find frightening, is the marked increase in the number of anti-vaxxers. And part of it is even coming out of this concept about COVID. First, we dealt with autism being caused by vaccines, which clearly the data did not support. And then suddenly all at once, we now have people refusing COVID vaccine, okay, but extrapolating, we won't take COVID to, we really don't think any vaccines are safe. So the incidence of anti-vaxxers has gone way up at this particular point. That is associated, again, and it's really strange, with the incidence of people knowing that if you're going to go to the doctor, there are certain things they're going to be looking for and certain things they're going to be insisting that you do. So suddenly all at once, we have an increase in the incidence of no prenatal care. Suddenly all at once, people have decided to go back. I don't know if any of y'all remember when I first started, the big deal about people having babies at home. The idea that, and there were so many maternal complications and fetal complications that went out of vogue. So we're back to that. We have people there, so there's a marked increase now in, and it's not that I don't believe in holistic medicine to some extent, but I still think that polio is best treated prevented by giving a vaccine. So there is a whole bunch of complicated issues that are going on right now that are contributing to what we thought we had actually resolved, that everybody accepted something as simple as vaccine, that everybody agreed that getting prenatal care was a good thing, that taking your blood pressure medication was a good thing, to the point where in our communities, and not just in community, it used to be one of those things was in vogue in, your West Side LA people who decided that everything should be holistic. Used to be a famous, if y'all remember the Hollywood Madam's father, who took care of a lot of Hollywood stars, and he was an anti-vaxxer. So unfortunately, those are the kind of complicated issues that we're dealing with now. And interestingly enough, a lot of this trust comes very specifically out of the COVID and the issues that people dealt with COVID. So I don't exactly know how you approach them, because in many ways they're totally illogical. Because,
and we now have an anti-vaxxer running for president. I understand.
Exactly right. You've got an anti-vaxxer who's running for president.
Unfortunately, he's not Republican, he's Democrat.
So Dr. Maxey, first of all, always great comments from Dr. Bean. Thank you so much, Dr. Bean. I would like to take issue with one of the things that Dr. Nabor Stevens said earlier, which was that it might not be scientific, and then she talked about common sense. Dr. Nabor Stevens, you and I both know common sense ain't common, but it's absolutely scientific. We are at a point, much to support Dr. Bean's comments, where Lord knows we need common sense. Lord knows we need people to be able to do things that make sense and talk about things that make sense and try to encourage people. And I want to go back to our dear friend, Dr. Wilbur Jordan, who talked about how important it was for folks to have a primary care provider, because that would be someone that you know, that you trust, who would get you into these rituals of regular follow-ups and regular exams, regular immunizations. Those are, they all go together with common sense. So please, Dr. Neighbor-Stevens, don't be putting down your own exclamations about the importance of common sense. It's desperately important.
Thank you, Dr. Walks.
Ditto. Let's go to our next set of slides. This should be interesting. I think either Dr. Hines or Dr. Neighbor-Stevens should read these.
Go on, Dr. Hines.
Fertility. The COVID-19 impact on fertility rate was a lot stronger in the states that had an earlier hit. The states that got hit in the spring, like the Northwest and the Northeast. The South got hit a few months later, and the effect on fertility rate was not that strong.
Next slide.
Red versus blue. The research team took a step further and examined other factors that could have influenced fertility rates during the first two COVID-19 waves. Study authors analyzed states' political leaning and social distancing units, which tracks changes in people's mobility using cell phone data. They found states with stronger social distancing responses that leaned politically liberal saw steeper fertility rate declines after the first wave of the pandemic. For example, politically liberal places like New York and Washington, D.C. had the highest social distancing indexes and the lowest fertility rates, while conservative states like Idaho and Montana had the lowest social distancing indexes and the highest fertility rates. Well, that makes sense.
Go to the next
You can't
slide.
make babies if you're not near each other.
That's exactly what I was thinking, Dr. Hines.
Heading into COVID, we already saw that fertility was higher in red America than in blue America. But COVID seems to have augmented this divide in family formation, with blue states seeing much greater declines in fertility than red states.
Is there another slide on this?
Economic factors related to fertility rates have historically followed, so fertility rates have historically followed economic factors, but the study's findings suggested that may have been exacerbated during the pandemic. Researchers found states with greater income inequality, higher percentages of college-driven earners, and larger drops in employment at the start of the pandemic saw the biggest changes in fertility rates. While these issues have always been linked with decisions about having children, they were clearly magnified by the pandemic, highlighting the need to address underlying social factors that constrain people's ability to grow their families, especially during times of crisis, she said. The study may only highlight correlations and doesn't explain how these factors influence birth rates. But Khan said it's important to continue to study U.S. fertility rates through the context of each state instead of the nation as a whole.
Yeah, the reason I put this in, I don't necessarily believe in conspiracy theories, but I'm always looking for some of the reasons why I think certain of these red states are so idiotic in their approaches. And it looks like there's a number of factors that have to do with fertility. So just thinking, I'd like a little bit of discussion that can help our audience why this is so important and how it plays into the political realities that are going on, especially with the stopping of using certain drugs and Roe versus Wade and stuff. Who would like to take that on?
Can I ask for a point of clarification, Dr. Maxey?
Go right ahead.
Because it sounds like we may be talking about birth rate as opposed to fertility. And those are different things. So back to the comment that Dr. Hines and I jointly made, it's hard to get pregnant when you're not close to anybody. But the fertility of an individual is different than the birth rate. So are we talking about birth rate here?
I think they meant fertility rates. Now, it wasn't clear to me that it was anything other than fertility rates, but it could be linked that's included. This is your language, Dr. Neighbor Stevens, the difference in fertility and birth rate.
I agree. I was troubled by this. I thought this was a jumble. I'll just call it a jumble of things to make a point that may have been preconceived, that they were trying to reach. Fertility rates has to do with, as far as and Dr. Walks is much more of an expert on this than I am, but
I'll look up the definition if you'd like.
Thank you so much, Dr. Hines.
Yeah. So fertility rate. So the total fertility rate of a population is the average number of children that would be born to a female over their lifetime. If they were to experience the exact current age-specific fertility rate through their lifetime, they were to live from birth until the end of their reproductive life. So I think what we're talking about is that when we're talking about fertility rate, I'm going to assume that they're meaning the average number of children born to women of reproductive age during the time period that is studied was lower or had differences, not necessarily fertility in the concept of the ability to get pregnant or the ability to have a baby, but the rate of children born during the time frame is what I think that we're talking about compared to quote unquote normal or pre-COVID times or whatever the baseline that they were considering.
Okay.
I think that this is the comments that I would like to make are not. I don't have the facts to support, but I would wonder, and I'll put it that way. I'm not stating this as a fact, but I would wonder if you are concerned about your economic status, which many families were during the pandemic, that would lead to actively attempting to have children during that time. And if you were in a position and or state where the economy was not as impacted by the pandemic, that would be less of an issue. I'm just putting that out there.
Yeah, it also mentions there's a higher degree of percentage of college educated wage earners in these populations where the fertility rate was lower.
I think that would support what I just said.
Mm-hmm. Does any of this play into what's going on with this judge who wanted to stop the use of the abortion drug, misoprostol? How do you pronounce it?
Yeah, I can't say it either, but you and I,
misoprostol.
You and I kind of have a different take on all of that. I see this as being a political tool that goes back 50 years, this whole birth control issue. Has been a political tool. I know that you feel differently, but I definitely think that it is a political tool.
Oh, I feel the same. I don't disagree with you on that.
So I'm trying to think about this, Dr. Maxey, with respect to some of the concerns that our audience may have from a health perspective, and I think that it's important for us to understand that health stuff is intertwined with political stuff and economic stuff. And so these are always decisions, whether there are going to be more children added to the family, whether we're going to get to the doctor because we've got to ride 2 or 3 buses. There was a story in the news today about decreasing public transportation resources because fewer people have been riding public transportation since the pandemic. So we've had an increase in folks working from home, fewer folks on mass transit. A lot of these things impact a lot of the factors that determine how healthy communities are. How much of it is conspiracy? How much of it is incidental? I don't know. I know that the things we can control, we definitely have to control. For example, our knowledge about the safety of a particular population or group or community or ourselves during pandemics, higher rates of people spouting misinformation about vaccines and the safety of all vaccines. All of those things are relevant to our community in a major way. We have got to have trusted sources of good health information.
Excellent, excellent. I look at everything in a political light, and I think that there's a lot of this that needs to be unpacked. Are there any questions in our chat or discussion points? Anything in the chat, Dr. Walsh, Dr. Neighbor Stevens?
Looks quiet right now.
Okay, well, we're pretty much at the top of our hour. I went to the celebration for Dr. Wilbur Jordan on Friday, and it was very well attended. People flew in from all over the country. I know Dr. Virginia Kane was there, and a number of other representatives, Congress people. And the most important thing I saw, there were so many of his patients there that were testifying as to how he saved their lives and how they wouldn't even be here had he not dedicated himself to treating them. And there must have been about at least 20 to 30 people having words on the program. But it wasn't boring. Everybody was supporting Dr. Jordan and all that he's done. And I was just so impressed with what people had to say. He was truly a hero and a warrior, not only in our community here in Los Angeles, but nationwide. And we miss him greatly. And I think for our next few shows, I want us to even remember him. Any other comments on Dr. Jordan from any of our people on the line, including not only our moderators, but our advisory committee and our lay people?
I want to share my takeaway. There were a lot of marvelous tributes to his life and work, and well-deserved. But the thing that I took away that I just kind of burned in my heart was what one of them said as a mentor he had helped him to embrace. And that is, we need to be bold and we need to be loud.
And he was both.
Well, I wanted to thank Dr. Neighbor Stevens for making sure I had the information so I could join remotely and listen. And when I mentioned Dr. Jordan earlier, it was just part of being normal Dr. Jordan was always with us and always contributed the importance of that primary care person that was going to be providing for you. So I don't think we'll have any trouble continuing to keep Dr. Jordan top of mind, Dr. Maxey. His impact continues to be profound.
I want to recognize Dr. Sherrod for a couple of words on Dr. Jordan. She gave a wonderful talk on Friday. Can you unmute Dr. Sherrod?
Oh, good afternoon. Thank you, Dr. Maxey.
You want to have
Yeah, Dr. Jordan was a giant, and he just extended himself and assisted so many people in so many ways at so many levels. I mean, to me, he was like a big brother, and he was a mentor because he kind of guided my career path. You know, I was always interested in infectious disease, and he was too. And he was the person that told me about the Clinical Scholars Program and how to combine the fellowship with the Clinical Scholars Program. And he also introduced me to the CDC, and I developed my high regards for the CDC from him as an EIS officer. And I actually went to one of their conferences, and I was just so impressed with the kind of work that was being done at the Center for Disease Control. And also, you know, he mentored not only professionals like myself as a medical student, as a fellow, as a resident, but then his patients. He mentored everybody. You know, I can remember Dr. Coombs, and she can speak for herself, but you know, he tore up her acceptance to Charity Hospital and sent her to Mass General when she matched for training. And lo and behold, she became the first Black woman, I think I'm correct, editor of the New England Journal of Medicine.
Is Dr. Coombs on?
Yeah, she's on today.
Can we unmute
And
her?
let me just say this, Dr. Maxey, before you go to her, that he was instrumental in promoting AIDS education, but not only AIDS education, but education of infectious disease through the Association of Black Women Physicians, you know, which was started in 1982, was co-founded with 48 charter members. And Dr. Jordan would frequently send me emails about what we should be doing through ABWP. You know, our vision was to empower Black women physicians to lead in health and wellness for themselves and for their community. And he actually facilitated that process. We actually worked with him on legislation when the face of AIDS began to change, where Black women became a highly infected group because of the incarceration of Black men. So we were working on legislation to try to get Black men tested before they are released from prison, because that was a main mode of infection. So, you know, he was just phenomenal. And he would often say to me, Jesse, this is what you all should be doing in the ABWP. So, you know, he not only suggested it, but he facilitated that education through simply speaking. He sent speakers to us, so to assist us in the educational process. And
great.
I just can't say too much about Dr. Jordan. He was like a brother to me from the time that I met him back in Boston as a medical student.
Good. Well, thank you, Doctor.
Mhm.
Dr. Coombs able to unmute for a moment, and we'll get a few moments before we sign off. Dr. Coombs?
Thank you so much. And I appreciate, Jesse, you remember so much of what was happening back in the late 70s. And I appreciate Dr. Jordan because of his incredible footprint on my life. But he taught me something that's really valuable, is that in life, you should be reproducing yourself, someone who's just like you or similar to you, and instill within the passions. He indeed redirected my life. And part of my being president of the Medical Society, which not the editor of the journal, but I was actually in charge of the editor of the journal and the whole enterprise of MMS in terms of being the head of the board of trustees and being the head of the COAM, which determines the salary of everyone at the New England Journal as well. So it was a daunting task, but I would never have been there had it not been for Wilbur Jordan. Would not have. And I see how God plants people and weaves into the fabric of everyone's life different people, and he was woven into so many people's life. And so every time I saw him at the NMA, I just hugged him up. I just, sometimes Wilbur didn't want to hug on you too much, but I said, no, I'm coming at you. And I just loved him. And I sent a picture, I think, in the email of the last NMA that we were together. And he met, my kids, he met my husband. And I love his just his spirit, and I love his just the energy and his brilliance. And he could see things from a distance. And I think it's really important that one of the things I've taken away is that be sensitive to the moment that God has placed in your life to be that same person that was in your life. And thank you so much. Thank you, Black Health Trust, because every time I would see his face on there, I get on, and it was just it's so precious. It was just so precious. Thank you so much. And I can't say enough about him. Thank you.
Thank you so much, Dr. Coombs. So final words for our moderators, Dr. Hines.
So thank you, everybody, for joining today. I didn't get the opportunity to engage with Dr. Jordan until I joined the Black Health Trust, but his passion is what struck me, right? Like his passion clearly for people and for them to be the best versions of themselves. And I am grateful that when I saw, when reading his resume and things, all the things that he's done, that spirit that zaps the life out of so many physicians, that it didn't get him, right? God didn't let that. God
Yes.
did not let that get him. And he was working till God called him home, and all of the lives that he impacted along the way. That's what struck me, is that passion and that love clearly for people that allowed him to do that. So I'm grateful for the opportunity to have met him.
Thank you very much. Dr. Walsh?
I really enjoyed Dr. Sherrod and Dr. Coombs' comments, Dr. Maxey. We talked in church today about finding new life as you were baptized and what have you. And then we talked about living that new life. We talked about the importance of not just knowing that you have new life, but actually living it and sharing it with others. And so I think about living what you say and living what you believe and living your passion, and the opportunity for many of us to be exposed to folks like Dr. Jordan and folks like Dr. Maxey, people that have a passion for others and have a passion to share and actually live that. So I'm thankful for that. I'm thankful for the opportunity to know of the work of some of the giants in our community. And I'm happy to have been a little itsy bitsy tiny piece of the message that many of our giants in our medical community and in our community at large have been able to share. Thank you, Dr. Maxey.
Thank you. While we're waiting on Dr. Neighbor Stephen Simon, can you find that video to close out on when great trees fall? To take us out. Dr. Neighbor Stevens?
I think I would like to close on the thought that as we reflect on the giants that have dotted our history, remember that we need to incorporate the gist of their greatness into our lives so that it can be perpetuated. We're talking about Dr. Jordan. I'm also thinking about Harry Belafonte that passed this week, another person who used his position to help anyone and everyone, and through that achieved his greatness, and try to help our young people understand it's not all about me. I think that's one of the things that really worries me as I look at our younger generation. And we're going to be talking about the younger generation as this is Mental Health Awareness Month, because Black children have the highest rate of mental health issues since the pandemic. And we, as I've said many times before, we can't wait for somebody else to take care of this. We need to take care of it. And we will be coming back to this subject, I promise you.
Thank you so much. And my final words are, my week has been consumed with the closest that I felt for Dr. Jordan. As I mentioned in my speaking to the group, that I don't even know when I met Will, but I've known him so long since we were medical students. He interviewed me when I was considering Harvard for my internship and residency. And late at night, we would commiserate on various ward nursing stations and hospitals because we made our rounds late. He had so many patients and I did too. So we talked about everything. He was just a great, great man. I'd like Simon to close out with our video, if we can, of When Great Trees Fall. Were you able to find that, Simon? Simon, were you able to find that? Maybe not. Okay. Well, everybody have a great. Did Simon find it?
It looks like he is screen sharing. There we
Yep.
go.
Okay, have a great Sunday. Let's listen to this and we'll sign off. We can't hear it, Simon. Can we fix the sound?
I think this will be the first Black Health Trust, Dr. Maxey, where we assign homework. And the homework is for everyone to go to YouTube and find When Great Trees Fall by Maya Angelou.
Very good.
It wasn't working?
No,
Nope.
we could see it, but not hear it.
Okay. All right, well, I'll put the link in the, I'll send the link out to everybody on the mailing list as soon as we get that issue fixed too.
Okay.
Thanks, Simon.
Thank you, Simon.
My
You-
pleasure.
Today we couldn't even get invitations out except for you.
I do what I can.
Thank you.
Yes, you do. We appreciate it.
Have a great Sunday, everybody.
Bye,
Bye.
everyone.